On Friday, the Minister of Education and Sports, Janet Museveni, indicated that the government was hoping to access vaccines for students before the reopening of schools.
It would make it much easier if all our students were vaccinated. Then we would open schools. That is not to say that they can't get COVID-19 again. They can, but at least it would be mild having been vaccinated.
This message was echoed by President Yoweri Museveni in his speech as he lifted the 42-day lockdown.
Schools will remain closed until sufficient vaccination of the eligible population and children aged 12 to 18 years old has taken place.
Slightly over 900,000 people have been vaccinated with one dose of the AstraZeneca vaccine, while only 240,000 have been fully vaccinated with 2 doses. This is a far cry from the target of 22 million people. In May this year, the European Union approved the Pfizer vaccine for children over 12 years, and other countries like Canada and Brazil have followed suit. However, what is Uganda's capacity to vaccinate the over 15 million learners?
As soon as the Pfizer vaccine becomes available, the Vaccine Advisory Committee will give advice.
Dr. Gavin Nyanzi, the chairperson for publicity and mobilization in Uganda Medical Association, says that with the competition for procuring vaccines, it might take the country more than 3 years to fully vaccinate all students. He says the viable option would be for government to set up COVID-19 testing facilities near schools in the hotspot districts so that students are routinely screened.
In terms of cost, you find rapid tests actually, for those that are buying wholesale, you can get a rapid test at 17,000 shillings. So unlike DNA PCR, the least you can get it is at 100,000 shillings. So getting rapid tests in all the teaching, learning institutions would be a very, very viable solution out of this.
The fear that schools, once open, may not disclose COVID-19 infections, as happened before the lockdown, is understandable. Patrick Kaboyo, the technical advisor of Education Advocacy with a Difference, a platform that aims to deliver an inclusive, responsive education, calls for cooperation between stakeholders to secure the future of learning.
But we also know that the future of education can only be granted or guaranteed only when learners are safe and healthy. If there are no learners, there is no education. If there are no learners, there are no schools. So we have to have a spirit of cooperation and ensure that we press the need for having vaccines brought in the country within a clear timeline, and it should not take forever.
The COVID-19 pandemic has caused uncertainty in the education sector, but if a way forward is to be charted, the opinions of parents, guardians, and teachers need to be incorporated in planning the school calendar. Gillian Nantume, NTV Weekend Edition.